from Acupuncture and Chinese Medicine by Alexander Humphreys. I just wanted to talk today about acupuncture needles. This is something that when a patient comes for their first acupuncture session, they're quite anxious about the needles. There's a lot of misconceptions that acupuncture is either very, very painful because the needles are very big, or we use the same needle again and again, or there's chance of infection. All of those things are incorrect if you're actually seeing a trained practitioner of acupuncture. If you do go and see an acupuncturist, make sure that they've got that correct training. Make sure they've got at least 3 years degree level training in acupuncture, and also that they're fully insured or a member of the British Acupuncture Council. So with needles, there's very little to fear with acupuncture needles. Even the term needle doesn't necessarily describe them because they are very, very fine. Some of them are about 0.40, 0.60 millimeters thick, so they are very, very tiny. However, a standard gauge needle is usually between 0.20 to 0.25 millimeters in thickness, and usually in terms of length, they're only a couple of inches long. I'm just going to show you some acupuncture needles and what they look like. So with acupuncture needles, they come in a blister packet and they are single use. We never reuse needles. Obviously with the needles, they're completely sterilized and single use. So there's no chance of cross infection. So there's nothing to worry about on that front. Obviously it's completely hygienic. So when we do acupuncture, we take the needles out of the packets and they come with what we call a guide tube. And a guide tube is a little plastic tube that aims and guides the acupuncture needle into the very precise point in the body. So with acupuncture, we don't just put the needles anywhere. There is a logic and a reasoning to where the needles go. So the tube aims that needle into that very specific point. So this is the actual needle. This is a 0.25, but you can see that it's very, very, very fine. And we've got a plastic head to the needle there. In terms of that's the standard gauge needle, so we'd use these for the arms and the legs, the back. However, certain areas of the body like the ear or the face, we might use even smaller needles. So I'll just put this in the sharp spin. For example, this is a 0.16 millimeter needle. So 0.16 millimeters is even finer, and you can see, might not be able to see it. This is the red handle here, so it's very, 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 very tiny. So this needle we might be using on the face or the ears, and we do even use even smaller needles depending on who we're treating and what area of the body we're treating. After the needles have been inserted and the needles are retained for 20 minutes in your acupuncture session, we dispose of the needles in a sharp spin, and that sharp spin, once it's full, is collected and incinerated. It's biohazardous waste. So you don't need to be scared. You can fit about 20 to 25 acupuncture needles into a hypodermic needle, into the tip of a hypodermic needle. So this gives you an idea about the difference in size. It's nothing like an injection or having blood taken. Most people feel very little with the acupuncture needles. So obviously, if you've got any questions about how acupuncture works or what it's used for, or any more questions about acupuncture needles, then I'm very happy to answer them. So please just leave a comment or send me a message and I can answer your question. So I hope you have a good day, and I hope that clears up some anxiety about acupuncture needles. They're definitely not knitting needles. They're not big. They're very, very tiny. So have a good